Ayesha. I'm a graduate student of public health as of this fall, and I'm hoping to pursue a career in the medical field in the future as well. This past summer, I had an incredible opportunity to work with kids with disabilities in an academic setting, so whether that meant helping them emotionally, socially, intellectually, or any other capacity, I was there to help. I also landed an amazing opportunity to shadow a physician at one of the country's best research and teaching hospitals. She was an amazing specialist. She is an oncologist and a palliative care expert. One of the most striking aspects of this experience for me was the way she handled herself with such grace around people in times of need. She not only checked in with the patients, but she also made sure to ask the families how they were doing. Not just, how's it going or how can I help, but it was always more than that. She exchanged stories with them, exchanged laughter, anecdotes, whatever it took, to make sure that they felt that they were truly being cared for. I was deeply affected by what I learned from this experience, and I'm excited to have the opportunity to share these thoughts and insights with you. So patients receiving palliative care are usually individuals who are affected by a chronic or serious illness. So the patients that I saw particularly while I was shadowing were patients who were actively receiving cancer treatment, patients who were no longer in active treatment, or they were otherwise impacted by the symptoms of a chronic illness. My experience in shadowing has taught me that palliative care is a relatively new medical field in which physicians, nurses, social workers, and spiritual care personnel all come together to alleviate the symptoms associated with the patient's illness. So this ties together all kinds of care, whether that be medical, physical, psychosocial, existential, or otherwise. When the patient came in for their first palliative care appointment, they usually sat down with the chaplain and the medical social worker. So they discussed what their goals of care from the palliative care team were, and this was usually referred to as the goals of care conversation. Of course, the overarching goal for palliative care patients is always to relieve the burden of the illness on themselves and their families, but the palliative care team wants to know more. What events is the patient looking forward to? What matters most to them? These are the questions that they ask, and they may seem like straightforward questions, but to me and many others around me, they ignite a feeling of control when many things in life are uncertain. This holds especially true for those living life with symptoms that affect their day-to-day activities as well as their long-term goals. For example, there was one patient who just wanted to be able to attend her son's engagement party just 10 days away. There was another patient who wanted to be able to finish writing a book for his grandkids because they wanted to know more about his life, and he wanted to make sure that he would be able to pass his legacy on. So there were some patients who knew exactly what they wanted from their treatment and from their lives, but there were others who sat in silence while they were thinking about truly what matters most to them. Equipped with these answers from the goals of care conversation, the palliative care team was able to create a plan for the patients and their families to help maximize their quality of life. So whether that be providing in-home aid or physical therapy for the patients or group support for the caregivers, the palliative care team was there to help. Every time I came home from shadowing, I always told my mom about what I had seen and experienced that day. What really struck my mom, who is also in the healthcare field, is how I shared these stories. It was never just about the diagnosis or prognosis or treatment. It was about these goals of care, what mattered most to the patient, and how the entire team came together to fulfill their wishes. This is why we, as a whole community, are so powerful. By understanding palliative care and its importance, we have the capacity to help our family and friends cope with difficult situations. This experience altered my perception of the entire medical profession. It helped me realize that medicine is not always a one-size-fits-all kind of prescription. It really depends on what the patient has been through in the past and what kind of experiences they're hoping to have in the future as well. So it's highly variable depending on what the patient themselves is trying to achieve. In my own interactions with friends and family, or even strangers, I find myself being more thoughtful about what experiences may shape their perspectives and actions now. In the future, I am sure that opportunities like these will continue to shape my experience personally and professionally for a lifetime.